Clinical depression or major depressive disorder, MDD, is one of the most common mental health disorders, with almost 21 million adults in the US having experienced at least one major episode, depressive episode. As mental health continues to be an increasingly prevalent crisis in the US, today I have Lisa Harding, board certified psychiatrist, and Mark, who lives with treatment resistant depression, join us to talk about Mental Health Month. It's May to discuss the challenges that come with difficult to treat depression and how to navigate finding a treatment option that actually works. Good morning to both of you.
Good morning, James, and thank you for having us.
Well, thank you for joining us on Morning Blend. So, Dr. Harding, can you tell us about the signs and symptoms of clinical depression and how common it is?
Yeah, you mentioned 21 million patients living with depression, and about a third of those actually have tried two or more antidepressants at adequate dose and duration and haven't responded. As part of my job, I'm a researcher, and I'm pretty fortunate to be working with Johnson and Johnson. And they actually have a treatment called Spravato for treatment-resistant depression. So clinical depression is a term that we use clinically to sort of diagnose somebody with depression. But those people living with it know that when they have a persistent low mood and sort of the inability to engage in life, those are really what we call the major symptoms of depression, James. And the minor symptoms are the ones sometimes people don't think about. So people can lose the ability to concentrate, they can have a fluctuating appetite, their sleep can be disturbed, believe it or not, and weight gain and weight loss are both associated with depression.
Now, Dr. Harding, what is treatment resistant depression and what is an available treatment option?
Yes, and so the third of patients that cycle through antidepressants, meaning that they try and don't respond to two or more antidepressants at adequate dose and duration, those are the people that we call treatment resistant. Those patients, it's a really stigmatizing term, and it's really that we haven't had a treatment to date to treat treatment resistant depression. So in 2019, the FDA approved Spravato, which has to be done in a REMS-certified treatment center for safety reasons. And that is one of the treatments that's been FDA approved for treatment-resistant depression.
Now, Mark, can you tell us about your experience with treatment resistant depression?
Sure thing, James. First of all, thank you for giving me the opportunity to get my message out there and my experience, and thanks to Johnson & Johnson for working with me and allowing me to do this. So the way depression affected me was it not only the depressed mood, which is in the name, but it also just prevented me from experiencing joy with anything in life, whether it's social time with friends and family, hobbies, sporting events, concerts, those types of things. While I would go through the motions and attend those things like I thought I was supposed to, I would find no joy in that. And it just made my life just a routine and more of a chore than experiencing joy and enjoying life.
Mark, how did you feel when you first received this diagnosis?
I was in disbelief. People of my generation, we don't grow up understanding what depression is. We don't understand the definition of depression. So given my situation in life, I was employed, I had a good family, I had a really big social network. I had, as we would say, I had no reason to be depressed. So I was in disbelief and somewhat in denial of it when I received the diagnosis.
Wow, I mean, that's got to be something going on there. So, Mark, can you walk us through your current treatment plan?
Absolutely. So about 2 years ago, my therapist referred me to, or actually informed me of Spravato and referred me to a local clinic where I live. I started receiving treatments again about 2 years ago. And after the first week of treatments, I noticed a marked improvement in the noise or the disorder in my thoughts. There was less noise, less intrusive thoughts, and I was just generally more relaxed. Over the years, there's been incremental improvement to the point where I am today, and I actually look forward to tomorrow. I look forward to social activities. I look forward to my hobbies. I look forward to speaking to people about this topic because my hope is that others can find the same relief that I have.
And Mark, you're doing a good job so far, man. I appreciate you being with us. Definitely, definitely. So, Dr. Hardy, how can people help a loved one who has treatment-resistant depression or has not been able to find the right treatment for them?
Definitely, and like how Mark saw a marked improvement with his treatment, one of the first things we can start off by doing is one, talking to a loved one, having them take you to the primary care doctor. You have to have a diagnosis by a clinician, and the clinician will assess you for safety and the appropriateness for treatment. From there, if you're just looking for information, you have to definitely look at a reputable website. We know that Dr. Google is out there, but spravato.com is the official site. You can actually read the clinical trials, and there's a place for clinicians to get more information, and there's a part for patients to get more information. In fact, there's a Find a Spravato Center part of the website where you can put in your local zip code to find the certified treatment center that's near you.
Dr. Hardy and Mark, where can we go to learn more?
Yeah, so that same website, definitely, you can start off there. The first point to contact is really to talk to your clinician about this treatment because they can assess you just in the way that Mark was assessed for safety first before, but the reading material on spravato.com.
Mark, Dr. Harding, thank you so much for joining us on Morning Blend. Mark, I know under your shirt you have this huge S on your chest for Superman.
He does.
Thank you again. He does. Thank you for your courage, Mark. Dr. Harding, thank you for the information. And thank you both for joining us on Morning Blend.
Thank you, James.
James, thanks for the opportunity and the kind words.
Thank you.